I'm Erica Brashears. I'm from Tonasket, Washington, and I'm in the Eastern Nursing Program. I was born with one kidney functioning, and I spent a week over at Children's in Seattle, and ever since then, I knew that I wanted to become a nurse and help people the way I was helped as well.
I'm Kaylor Ariel. I'm from Poulsbo, Washington, so the west side of Washington, and I'm here as a nursing student getting my BSN. What drew me to nursing, my older sister is actually a nurse as well, and her son, so my nephew, was in the NICU for a while when he was first born, so I got to see a lot of the neonatal intensive care, and I think that's where I'm hoping to end up in the future.
Hi, my name is Wade Romine. I am from Chehalis, Washington, and I'm here at Eastern Washington University School of Nursing to get my Bachelor in Science of Nursing. I chose nursing because when I was a child, I was hospitalized with a rare disease. I was paralyzed, and they took care of me. And it takes a lot of strength to do that, and I thought I want to share that strength with my community. So that's why I wanted to pursue a degree in nursing. So
the first 2 years, you're in more general classes like English, math, and all that, getting your anatomy and physiology out of the way. So those could be larger lecture halls as well, but once you get into the nursing program, it's a lot more hands-on, tactical learning. You're putting into play what you're learning as well, because one day you might have a lecture on IVs and then the next day you're putting in an IV in someone. So I thought that was really fun. It helps me learn it a lot better. I like to be hands-on, and so I feel like the first time I stepped into the skills lab, I was a little bit in disbelief that this is what I get to do for school every day.
In class, we're learning previously holistic care, right? So it's everything from putting in an IV to administering an intramuscular injection for the flu, all the way to peri-care and putting in catheters and how to change a bed. Kind of the entire patient care experience.
There's a bunch of study rooms which are nice. You can use the whiteboards in the common areas. There's lounges around here. There's the sim lab, skills lab, lecture rooms as well. Everything's pretty much up for grabs 24 hours of the day. You just badge into the building, so you can use it as you like, which is also really nice because if I'm studying for an exam, I usually end up coming here early, doing some active recall on the whiteboards. It's really helpful for that.
The really awesome thing about this program is that everyone wants to help, and that sounds so basic, but I've never been so open to asking a professor or a preceptor or my fellow nursing students even a question that I felt was very dumb, because they are completely understanding that, okay, they want to give the best care possible. There is no dumb question in that capacity, and they just want us to be the absolute best that we can be for the sake of the patient and for the sake of our careers.
I chose nursing because when I was in high school, my grandma passed away and I was gonna be her caregiver, so that kind of started my interest in nursing. And then I decided to do Running Start, and I got some of my prereqs done with that, and then I chose Eastern for my actual nursing degree.
I absolutely love rotating through the hospitals for our clinicals class, where we actually get to experience what we're learning, but in the larger hospital environment and not in a simulated classroom environment.
One thing I really like about Eastern is I'm excited to be a psych nurse, and I think a lot of our classes really incorporate that idea of how mental health is vital for your whole system. And we also get to learn about it specifically in our behavioral health class, where we have a teacher who is so specialized in it. He's able to give us so much information. It's just a really awesome learning experience, and I'm very grateful that Eastern has that.
It's so helpful to know that what I'm spending all of my time on reading in a textbook, I can apply it to my future job working as a nurse, and it's something that's really important that I need to know. I just love the culture of Eastern's nursing program, where we do have some strict rules and guidelines, but a lot of it is, if you need help, just go ask someone. Any of the teachers or the staff are happy to help you, but also your classmates are also there for you.
One of my favorite parts about being in a cohort for nursing school is you just get so close to the people that you're around. You see these people 5 days a week, sometimes even 6 or 7 if you become close with them. So it's really cool how your relationships get to develop, and I plan to be a psych nurse, but my friends plan to be in labor and delivery, or they plan to be in med surg. So it's really cool how even after this we'll be able to connect and talk about our experiences, and it's just a really awesome part about it.
As a very first cohort, we have an incredible group of kids. I mean, they are amazing. And yeah, every experience that I've had with the nurses has been a positive reflection on Eastern's part whether it's the quality of the students, the education, combination of everything. Every interaction that I've talked to with the nurses and with the other instructors has been fantastic. They're very encouraging, they're very excited to see us. We're bringing a lot of excitement because we are the very first class of nursing students. Very excited that I applied here and seeing what they're bringing to the table, hearing some of the standards from other nursing programs and hearing ours is a lot higher. It really excites me to know that a lot of us students, kids and stuff, are going to be, I think, a lot better prepared to step out onto the floors or wherever they may end up, ready to go as nurses.
I feel like if you're thinking about going into nursing, whether you're like high school or transferring, it is a lot, but you do become really close with the people around you, and your professors really care about what they want to do. So I feel like the guidance here at Eastern is great. Great support system. Your professors know you personally, and they are really there for you, and they want to see you succeed. I remember I was pretty scared going into the program, but now that I'm in it, I feel like a lot more comfortable, better in my shoes, and more excited.